Thank you very much, Peter. I'm thrilled and honored to host this afternoon's luncheon and to have the opportunity to introduce our speaker, Larry Merlo, not only because he is the very successful president and CEO of the 18th largest company in the United States, but also because Larry happens to be my friend. 3 decades ago, long before any of us had ever heard of the Patient Protection and Affordable Care Act, a young pharmacist, fresh from the University of Pittsburgh School of Pharmacy, was focused on being the very best pharmacist that he could be. Let's just say that these days, Larry Merlo's professional life and our country's healthcare system have become just a little more complicated. In fact, today, that young pharmacist oversees a $120 billion pharmacy innovation company with 200,000 employees and over 7,000 retail stores nationwide. No longer filling prescriptions, Larry Merlo is focused on fulfilling customer and shareholder expectations. As the keeper of a consumer brand that has become a household name with 3/4 of Americans living within 3 miles of a CVS pharmacy, that's tightly integrated with one of the country's largest prescription benefits management businesses and an expanding network of retail health clinics, Larry leads a company that has become a critical player in the delivery of accessible, high-quality, and affordable health care in our country. CVS Pharmacy has generated industry-leading sales and profit results through both organic business development and acquisition. In fact, Larry Merlo has the best track record in the industry of integrating acquisitions, having successfully led 5 major retail integrations. He is known and respected for setting high expectations, building collaborative teams, creating an environment of candor and trust, establishing clear accountability, and delivering results. Not to mention being one of the good guys. You can take the boy out of the pharmacy, but you cannot take the pharmacist out of the boy. And now that he has mastered growing the business, he's reinventing it. Larry is here to discuss how CVS Caremark is reinventing the role of the pharmacist and how a reimagined pharmacy care model, one that pays particular attention to systemic savings and better health benefits, will be a necessity under health care reform and a particularly good thing for employers like all of us who continue to be concerned about the rising cost of health care. So, ladies and gentlemen, at this point, it's my pleasure to welcome Larry J. Merlo, President and CEO of CVS Caremark, to the stage.
Well, thank you, Karen, for that very kind introduction. And Peter, I'd also like to thank you for the invitation to join you today. And I'd also like to recognize one of our esteemed CVS Caremark board members, Marion Hurd, who is also here in attendance. Marion. And by the way, I know Marion is going to be checking to make sure all of you have your extra care card on your way out the door today. But it's a real pleasure to be here in Massachusetts. It's actually where we got our start as our first CVS pharmacy store opened back in 1963, just up the road in Lowell. And today in Massachusetts, we have over 350 CVS pharmacy stores in more than 30 MinuteClinic locations. And as Karen mentioned, we're very proud of the fact that more than 75% of the people here in Massachusetts and actually across the country live within 3 miles of a CVS. We're also happy to be near the heart of healthcare innovation. And from groundbreaking medical discoveries such as anesthesia to your pioneering role in healthcare reform. And today you lead the country in access with more than 98% of your citizens insured. And we've been proud to partner with many of you in helping implement this groundbreaking legislation. And while Massachusetts has been pulled into the debates numerous times and sometimes criticized, I believe you should be applauded for what you have accomplished. In every respect, your leadership is yielding promising results because you understand as employers, healthcare providers, educators, and business people the dynamics of the transformation that is occurring in the marketplace. And regardless of where this current debate on national healthcare reform ends up, the transformation is going to continue, and it's needed, And we face what many call a healthcare crisis, rapidly expanding costs and fewer people with access to the appropriate care. So I'm going to ask you to indulge me in an exercise for just a minute. I'm going to ask all of you to raise your hands. Come on, raise your hand. Okay, and now I'm going to ask every other person at your table to lower your hand. And while this is a random sample, that was not a tough quiz, okay? But if you take a look around the room, the number of hands remaining really represent the number of people in our country today, almost 50%, that have one or more chronic diseases, whether it's diabetes, hypertension, asthma, the list goes on, and many times these chronic conditions are accompanied by prescription drug therapies. And you can put your hand down now. And today, chronic disease in this country accounts for $3 of every $4 spent on health care. That's nearly $7,900 per year for every American with a chronic disease. And this is where the statistics really begin to get even more alarming, because 1 in 3 patients who start a maintenance prescription will decide to discontinue treatment before their first refill is even due. Fewer than 1/2 of patients take their doses as prescribed, and 3 out of 4 people will stop taking their medication within the first year of beginning therapy. Now, these statistics frame a big piece of what we're struggling with in healthcare today. In fact, I know many of you are familiar with a statistic from the New England Health Institute that cites the cost of prescription non-adherence to be a $300 billion, not million, $300 billion problem per year in terms of complications and preventable hospital admissions. And this does not include the costs associated with the 1.1 million people that may die prematurely as a result of the significant health problems related to not taking their medications. So non-adherence is driving unnecessary medical costs across our healthcare system. But there is something that we can do today to combat this. And last year, CVS Caremark published a study in Health Affairs that found that increasing medication adherence for chronic disease patients can meaningfully reduce costs. As an example, adherent patients with high blood pressure save nearly $4,000 a year versus non-adherent patients. So what's the problem? If we've identified the root cause of a major cost driver and a means to solve for it, what's holding us back? Well, it's a number of things, some of which I'll share with you today, and hopefully at the end of my talk you will have heard some ideas and options that all of you can take back to your companies and think about in supporting your employees or your members' health and avoid unnecessary cost pressure to the system. So let me take a step back and share with you 4 numbers that are what I call the new pressures on our healthcare systems. I think they're pressure points that will drive complexity and potentially exacerbate the numbers I just shared with you. These numbers concern me as they will force change and demand innovation in our current system, and I believe everyone in this room should think about them in terms of the impact that they could potentially have on your lives as well as your business. So the first number is 10,000. That's the number of baby boomers becoming eligible for Medicare every day, often referred to as the silver tsunami. Now, not only does this mean over 16 million new Medicare eligibles by 2019, it also means a long-term increase in demand for services and the use of medications. Because on average, seniors take 13 prescribed drugs. That's 3 times the number of the younger population. The second number is 32 million. This is the number of newly insured people as a result of national health care reform. And many of them are going to need help navigating the healthcare system. Our research shows that 59% of people say that healthcare is just too complicated. And health insurance exchanges are just going to further increase the level of confusion. The third number, 45,000. That's the projected shortage of primary care physicians by the end of this decade. This shortage will have a profound effect on both cost and quality of care in the context of the increased demand that's created by the first two numbers that we just talked about. In the fourth number, 20%. It's the percentage of our gross domestic product that will go towards healthcare by 2020. That means going from about $2.6 trillion only a few years ago, back in 2010, to more than $4.6 trillion 10 years later. And according to a 2008 World Health Organization study, we spend more per person on healthcare than any other country in the world. So given that the system is already strained and buckling under mounting cost overruns, what do? Well, our current approach to healthcare, I think, would all agree is unsustainable. We need many new approaches. We need to find solutions that can help address this increasing complexity that we're going to be facing over the next decade. And I'm convinced that one important avenue to improve care, cost, and access is rooted in the profession of pharmacy. So today I'd like to share my perspective on the role that pharmacy care is playing in this rapidly changing healthcare landscape, some of the things that we're doing at CVS Caremark that can help make this change work for the people that we serve. Now, we see firsthand the issues impacting patients, and consider some of these numbers. CVS Caremark sees over 5 million people in our retail stores every day, and we serve over 60 million members in our pharmacy benefit management business. We employ over 24,000 pharmacists, more than 52,000 pharmacy technicians, and over 1,800 nurse practitioners engaging these people on a daily basis. Now, pharmacy care has always been one of the most accessible parts of the healthcare delivery system. Think about this. How many times have you been to your primary care doctor in the past 3 or, say, 6 months? Now, how many times have you been to your local pharmacy during that same time period, even if it was just to buy a pack of gum? And in our pharmacy benefit management business, we manage a network of more than 64,000 pharmacies across the country that offer accessible healthcare professionals for patients to speak with each and every day. And I think traditionally people have thought about pharmacies as pill dispensaries. But we know that pharmacy is much more than that. And pharmacy has the potential to extend the front lines of healthcare, to deliver better outcomes at lower cost to the people that we serve. And at CVS Caremark, we're committed to innovations to do just that. We're committed to our purpose of helping people on their path to better health, and we're committed to reinventing pharmacy to reach more people with better care at lower cost. So I'd like to tell you about a few of the ways that we're accomplishing this, and again, some of the things that I hope you'll consider in your own companies as you support your employees in navigating this increasingly complex healthcare landscape. And let me start with the greatest asset that we and others in the pharmacy business have to deploy against disease and rising healthcare costs, and that's our people. Pharmacists are in a very unique position to help and are among the highly trusted resources for patients. In fact, over the past several years, an annual Gallup poll has consistently ranked pharmacists in one of the top 3 spots of most trusted professionals. And it's because of stories like this. A woman wrote to tell me that she recently went to one of our pharmacies with a concern that she might have mixed up some of her mother's medications. And she said, and I quote, "I showed Joelle and the pharmacist the small white pill. It looked just like the other small white pills my mother takes, and I told her what I thought it was. To my alarm, Joellen said it was not. This meant I had put double doses in my mother's pill box. Joellen very kindly reassured me that she would help me straighten out my mom's needs. She showed me the markings that distinguish one drug from another, and I went home with the knowledge and confidence to keep my mom healthy. She showed so much professionalism and caring in helping my family to avoid what could have become a catastrophic situation." Now, this kind of exchange happens every day all over the country. Pharmacists can and do help with a broad range of counseling and interventions, and this includes helping to address one of the biggest opportunities to improve health outcomes and lower costs, and that is increasing medication adherence. Now, how many of you are caregivers in this room? Because there are over 65 million of you across the country. And it's one of the toughest jobs in the world. And our more than 50,000 healthcare professionals are there to do their part every day. One of the ways we work to make this patient and caregiver connection is through a unique program that we have developed that we call Pharmacy Advisor. It connects pharmacists and patients to help people stay on their prescribed medications and prevent complications. These touch points range from phone counseling to email reminders to in-store counseling and home consultation for the most complex cases. And importantly, the research shows the program's working. A study that was recently published in Health Affairs revealed that adherence to oral diabetes medication doubled for patients participating in this program. And the interventions were cost-effective as well, with a return on investment of about $3 for every $1 spent. In fact, we estimate that our Caremark clients last year saved nearly $2.4 billion due to improved medication adherence for chronic conditions. And Pharmacy Advisor is a big contributor to these savings. So today it's available for diabetes and cardiac care, and we'll be developing applications for 13 chronic conditions over the next 2 years. We're also exploring other innovative ways to engage pharmacists to directly help people improve their health. And one important area is preventing hospital readmissions. Now, how many of you in the room have had a hospital stay or a procedure done? And when you left, you received new medications, a series of instructions that were maybe complicated, a little difficult to understand. Now imagine how the senior population manages this, especially when they are, as I mentioned earlier, taking 13 different medications. And if any of you have elderly parents, you have to think about this, because what are the odds that they're going to get their medication therapies right post-discharge? And industry research finds that 1 in 5 seniors is readmitted to the hospital within 30 days of discharge. And it's estimated that nearly 70% of adverse health events that take place after hospital discharge are related to medication management issues. So obviously, a significant health quality and cost issue. Now, we've tested in-home consultation by pharmacists shortly after people are released from the hospital. They address questions about medication and follow-up care, and the early learning suggests this consultation is reducing hospital readmissions, and we'll continue to look at this area and others that tap our pharmacist expertise. Now, let me turn to innovations that we're driving with our in-store clinics branded as MinuteClinic. Today, MinuteClinic's the largest retail clinic provider with about 600 locations in CVS pharmacy stores across 25 states and the District of Columbia. We expect to expand to more than 1,000 clinics over the next 4 years. And in view of the projected primary care physician shortage, they have a major role to play in improving care and access at substantially lower costs. MinuteClinic provides convenient, affordable, high-quality care for both acute needs as well as services like school physicals, vaccinations, and monitoring for chronic disease. They're open 7 days a week, including nights and holidays, and they see patients without an appointment. In contrast, the average wait for an appointment with a family practice doctor today is more than 20 days and actually as much as 60 days in some areas. MinuteClinic is staffed by highly trusted family nurse practitioners, fully accredited by the Joint Commission, and we accept nearly every insurance plan, including governmental programs. And MinuteClinic is lowering costs. A RAND study suggested care was 40 to 80% less expensive than alternative sites and very high in quality. A 2010 study among our own CVS Caremark employees showed those that used MinuteClinic had 8% lower overall health care costs compared to matched non-users. And we believe MinuteClinic is both replacing the use of high-cost sites such as emergency rooms, as well as addressing unmet needs for access to primary care providers. Both help to hold down overall cost of care. But I want to be crystal clear. We do not advocate for or believe that the family physician is going away or should go away. In fact, we see our MinuteClinic offering as complementary and collaborative with primary care medical homes and helpful to the system. To this end, we're expanding services at MinuteClinic to include more diagnostic and monitoring services. And as part of this, we're very excited about an important partnership with the CDC and the Centers of Medicare and Medicaid Services to support the Million Hearts program. And this is a program that seeks to prevent 1 million heart attacks and strokes in the next 5 years. And we're providing free blood pressure checks and education at MinuteClinics to help people stay on their heart medications. At the same time, we believe we can make an even bigger contribution as we expand our partnerships with major health systems. We now have formal clinical affiliations with 17 major systems across the country, including the Cleveland Clinic, Emory Healthcare, the Henry Ford Health System, and here in Massachusetts, UMass Memorial Healthcare. And through these partnerships, we see important opportunities such as increased continuity of care through the integration of electronic medical records. Another important lever that is widely discussed and not fully leveraged is the topic of prevention. The wellness and prevention argument is a powerful one, something that we think a lot about as an employer of more than 200,000 people, as well as being a healthcare provider. How can we empower our employees and patients to, as an example, know their numbers? Or understand the ramifications of their disease state early enough to avoid painful and costly symptoms that might otherwise be avoided with proper care and medication compliance. So we see prevention as one of the most important things that any of us can do to improve health and reduce costs. One important initiative, now in its second year as a national rollout, is what we call Project Health. It's a wellness program to provide free health screenings to multicultural communities. And we're donating over $21 million in services, and this includes comprehensive health risk assessments and screenings during key national health awareness months, like American Heart Month in February and Diabetes Awareness Month coming up in November. And we know that for a variety of reasons, multicultural populations have difficulty accessing and benefiting from preventative care. And we also know that they disproportionately suffer from chronic conditions. And Project Health can make a real difference in identifying these conditions and helping people on their path to treatment. Now, as I said at the onset, I'm very confident that pharmacy is a big part of driving positive health outcomes and lowering overall healthcare costs. I'm also confident that our integrated business model and pharmacy innovation approach can help. So what do I mean by this? Well, I think the best way I can explain it is to share an example. So I'd like you to meet Joanna. She's a diabetic. 2 months ago, her doctor prescribed a statin to help reduce her cholesterol and an ACE inhibitor to help address her high blood pressure. But she never had the 2 prescriptions filled. Joanna's employer is a Caremark client that's participating in the Pharmacy Advisor program. So when Joanna goes to the pharmacy counter to pick up her diabetes prescription, the pharmacist sees automatically, thanks to electronic records, that she has prescriptions for high cholesterol and high blood pressure that she has not filled. Pharmacist asks Joanna if she'd like to talk about why she has not filled these scripts. They have a conversation about how the medications work together with her diabetes treatment. She decides to fill the prescriptions right there, closing an important gap in her care and helping her better understand what her doctor has prescribed and why. While in the store, Joanna also sees a MinuteClinic. She learns that she can come in for regular diabetes monitoring and blood pressure checks, and she makes a note in her smartphone to do just that. It turns out that Joanna's employer has 100,000 employees enrolled in Pharmacy Advisor, and 6,000 of them have diabetes. Pharmacy Advisor has helped close gaps in care for more than 4,000 of Joanna's colleagues, saving some $3.3 million for her employer and that is just for one chronic condition. Now, this type of coordination of care, highly focused on disease states, is an important factor to consider when making decisions about plan designs for your employees. It's one that we have used at our company, not only because of the cost savings and better health outcomes, but also from a productivity and an employee engagement opportunity. We believe that employees who have control over their health make a more productive and a better engaged workforce. So to sum it up, there are a few things that we should all consider when thinking about healthcare today and the rising costs facing us as a nation. There are options we should be deploying that can make a real difference in the quality of our lives and our wallets. Let's start with medication non-adherence, especially for chronic disease. It's a big problem. Our goal together should be getting people to stay on their medications as prescribed. And in my opinion, this is the biggest underutilized weapon we have against the rising cost of unnecessary health complications. Next, we need to address the increasing complexity our current healthcare system creates, a situation that will only be exacerbated by the influx of 32 million newly insured and the silver tsunami that is picking up speed. Pharmacists stand ready to support and help translate some of that complexity for millions of patients who use retail and mail pharmacies or call centers to better understand their benefits and their drug therapies. Pharmacists are accessible, they're knowledgeable, they're trusted resources to America's patients across the country. And as a pharmacist myself, I know the value these healthcare professionals can play in the lives of patients. I believe pharmacy care can make a big difference in the health, the well-being, and the financial outlook of our country. And I know there's much more that pharmacy can do to improve both care and cost. Now, I also know that we can help more people on their path to better health faster with partners like many of you in this room. And does anyone in the room think that we have the healthcare system solved? Well, here in this state, you have been at the forefront of change and have made great strides in solving this cost, quality, access dilemma, but there is much more to be done. In the profession of pharmacy and CVS Caremark stand ready to help. So thank you so much for taking the time to be here this afternoon. And Karen?
I'm done. Larry has graciously agreed to take questions. And if you could please wait for the microphone. We have for our TV audience at home, that would be terrific. Yes, sir.
Yes, hi. Do you see one day that pharmacies will be employing primary care physicians?
Yeah, I think that's something that we have talked about. I think there are some states where the in-store retail clinics are staffed with physicians, and I think that's something that we'll continue to evaluate as MinuteClinic continues to grow and expand its suite of services.
Yes. Sorry.
Over the next year or two, do you expect to increase the number of employees you have in the region?
Well, we're very proud of the fact that here in Massachusetts, I mentioned we have over 350 stores. We actually employ just over 12,000 people, and we continue to grow our presence in the state, continuing to open stores and expand our MinuteClinic presence. So I'm sure that you'll continue to see us grow our store base here in the state.
Margie has a question.
About 4 or 5 years ago, there was a spate of stories about inaccurate filling of prescriptions in CVS stores locally. And I wonder, since then, if you could tell us about the processes that you have put into place to prevent that kind of misprescribing and misdispensing. It's a new verb.
Well, I mean, it probably goes without saying, but patient safety is of the utmost importance. And that's something that we continue to challenge ourselves in terms of how we continue to get better and better and better. technology becomes an important part of that solution. And, we have been able to leverage technology over the past few years to, put the additional, safety checks in place to, minimize the rare occurrence that does happen when there is, a prescription inaccuracy. I think the challenge that we have is, we talk about the fact that there is no process that is immune from human error, but we continue to look at our work processes and, again, technology to minimize that so that, we can be as good as we possibly can be.
One more, time for one more. I don't know if there's a microphone.
Thanks. Colin Hill, GNS Healthcare. So big data has become a very hot topic across many industries where companies like Amazon and Google use it to sell us more stuff and to match ads to people. How is big data going to ultimately transform healthcare in your mind and lead to better health outcomes at lower costs?
Yeah, that is a great question, and one that we continue to actively work on. I'll share one example that we have created what we call a pharmacy care economic model, where we're actually able to look at claims data and to do some predictive modeling in terms of, let's just say it's an employer of 100,000 employees, and to actually look at the number of those individuals that suffer from those chronic diseases, and through some of the programs that I talked about earlier, how we can reduce overall healthcare costs in a very quantifiable way. And I think that I like to describe it as I think we're in the third inning of a 9-inning game. There is much, much more that we can do on the predictive modeling side to influence patient behavior, with a meaningful cost reduction at the end of the game.